Hello, hello. Please don't eat if you're watching this video because it's about diarrhea and vomiting and I do not want to put you off. I wanted to share a story with you about an outbreak that I had to deal with on board a vessel I was working a few years ago. This chap turned up with abdominal pain, general lethargy and several episodes of diarrhea and vomiting, which are symptoms of something else that's going wrong. So in line with protocol, I isolated him immediately and tried to establish the cause of his diarrhea and vomiting symptoms. Couldn't do it. It was really difficult. And over the next 24 hours, I had a few other cases who presented with identical symptoms. So it's at that point we have to go to outbreak process, which means we have to up our sanitation levels. We have to consider notifying the authorities if we have a certain number, and that's normally on percentage of population or number of people affected on that particular vessel. So there's lots to consider. And by the end of it, I ended up having over 30 people with those symptoms. So I was beyond capacity, we were running out of medication. All I could do was treat the symptoms, which was the nausea, which was associated with the vomiting, the abdominal cramping and the dehydration just because of all the fluid they were losing. So we had drips up on them, they were taking medication in injection format so that they could actually hold fluids down as well. And we had to continue to try and establish the cause, which was the hardest bit actually. So eventually we managed to locate what had caused the diarrhea and vomiting outbreak, or what we believed to have caused it. And after careful questioning, it turns out that the sewage treatment plants had been backed up. And instead of cleaning it out and disposing of the item that they'd used a drinking beaker to clean it out with, and then rinsed it and then just put it back on the pile with the rest of the drinking beakers. And of course, you know, with a large crew, there's lots of people go through cross-contamination, and it was rife. So after 48 hours or so, their symptoms wore off and we were gradually able to return people to work, with the exception of food handlers, because they have to have at least 48 hours off after they're back to normal. And that was it, done and dusted. Lots of people lost lots of weight. They may have been happy about that, I'm not sure. But all in all, the idea is isolate, establish the cause, treat the symptoms, and if dehydration is a real issue, then you will have to consider evacuation. Over and out.